The last one, regarding any person suspected of having diabetes, what level of fasting plasma glucose or levels of random plasma glucose would you expect to measure? Right. This is a way to say memorize one group's opinion on what a diabetic is. This value, what a normal blood glucose is and what is diabetes, people argue about it continuously and have argued about it throughout my lifetime. So it changes. More recently, a diabetic had to have a fasting blood glucose over 140 milligrams per deciliter. And for years and years, that was true. Now they've changed it to a diabetic is a person that has a fasting blood glucose level of over 126 milligrams per deciliter. So they lowered it from 140 to 126. Why did they do that? Well, they had a good reason. For years and years, people weren't sure that high blood glucose was causing the problems. A person with diabetes is going to have all kinds of problems, neurological problems. They're going to have problems with their kidney. They're going to have problems with their nerves. They're going to have problems with their eyesight. All of those things they found can be stopped if you can keep the blood glucose under 126 milligrams per deciliter. So they had a new benchmark. They said, look, this is the disease. Not the high blood glucose is not the disease, it's just the way that we measure it. The disease is these things that happen because you have the high blood glucose. How do you stop this person from being diseased? You lower their blood glucose level below 126. So that's going to be our new level for what a diabetic is, 126 milligrams per deciliter. The normal range for blood glucose is probably just under, 77, 78 to 100. But the specific definition by the American Diabetes Association is what I'm telling you here. And that group gets maybe 100 physicians together, all specialists in diabetes, and they set a value. And I don't know of anybody that could set a better value, so that's the one we follow. The other thing we have is, if you're fasting, it's over 126, but if you measure 200 anytime, you don't care whether they just ate, they just had 7 sugar sandwiches, if you get over 200 milligrams per deciliter, you're going to call that person diabetic. Now, as the book says, you always recheck. No physician out there trusts the lab. A lot of bad things happen out there in the lab. People have weird metabolism. On certain days, people do strange things with their body. So you don't call a person a diabetic just because you measure the blood glucose one time. All right. Now we're going to start. We've answered all the questions. Now we're going to go through the case. Usually we won't do that. Okay. 26-year-old female with type 1 diabetes since the age of 12, and that's typical. They usually get type 1 when they're children. Type 1 diabetes was formerly called juvenile diabetes, or IDDM, insulin-dependent diabetes mellitus. It's a good thing to know that name because a lot of old papers and books won't change, and you'll have to know both of them. She has an absolute, complete lack of insulin, as we said, due to an autoimmune deficiency, autoimmune destruction of her beta cells of her pancreas. Without insulin, she suffers from hypoglycemia and ketosis. She was drowsy, nauseated, and vomited for 24 hours. She could not be aroused from an afternoon nap and was brought to the emergency room in a coma. Her pulse, her breath has the odor of acetone, her pulse rate is rapid, and she has Kussmaul breathing, Kussmaul breathing. She's breathing deeply and rapidly. The acetone on her breath is a matter of argument. There are physicians that will say, it's one of the ketone bodies, physicians who will say they worked in the emergency room with 1,000 different diabetics, they've never smelled acetone, and there's others who say that it's a dead giveaway. You'll have to learn that when you get out in the clinics. I can't settle that argument. I can tell you, though, that my wife can smell things I can't, and I can smell things that other people can't. So smelling is different between people. It may be that some people just can't smell acetone. Okay, the tests they ran on her. The first thing they did was an arterial pH of her blood, and that was 7.08. Remember, 7.1, just slightly above 7.08, she's got double the number of protons in her body, in her bloodstream, and probably everywhere else in her body that she should have. Her partial pressure of CO2 is 28 millimeters of mercury. What do we do with that value, 28 millimeters of mercury? We multiply by 0.03, and it's going to give us 0.84, 0.84 millimoles, because that's the term that goes into this equation, not millimeters of mercury. You got to multiply millimeters of mercury times 0.03. They're the same thing. It's just in the equation you have to use millimoles or milliequivalent per liter. Milliequivalents per milliliter. All right. Normally, the numerator of this equation, bicarbonate, is 40 milliequivalents per liter, and the denominator is 1.2 milliequivalents per liter. And I tell you that because it's a handy term to carry around. I know you got a lot of stuff to memorize, but if you can remember that, you've always got what normal is, and it helps you work problems. Okay, her serum glucose is 648 milligrams per deciliter. As we said, 200 is extreme for anybody, and she's got 648. As that glucose goes through the glomerulus and into the kidney tubules, her cells are not going to be able to pump it back into the body fast enough. A lot of that glucose is going to end up in the urine, and because it's polar, it's going to pull a lot of water with it. She's going to be dehydrated because of this. The ketone bodies that she's making are doing the same thing. She's got a ton of ketone bodies in her blood. Some of those are getting into the urine. They're pulling water, but the glucose is really, they call it osmotic diuresis. Osmotic diuresis is what she has. Okay. Her serum bicarbonate is 8 milliequivalents per liter, 8 millimolar. Normal is 24. Oh, God, did I just say 40? I'm sorry. This value should be 24. This should be 1.2. When I said 40 here, I was thinking of this, the value for CO2, the normal value for CO2 in millimeters of mercury. Normal value for this in millimeters of mercury is 40, but you can't use that. You have to convert it to millimolar, and then it turns out to be 1.2 millimolar. The normal value for bicarbonate is 24. And I apologize for making that error. Send you out in the street with that, and you'd be disaster. Okay, she has a lack of insulin, and this has increased her glucagon. And this has caused her fat cells to release a lot of fatty acids. And they're going to the liver and becoming ketone bodies, which are being released in the blood, and they're going through the roof. And they're all acids, so they're making her acidotic. And she's got all that glucose. When she comes in, she's hyperventilating. Why? She's hyperventilating because this value is down, and to get the pH to go back up, the only way she has left to do it is to lower this value of CO2. And she's going to do that by hyperventilating. I think we've covered everything else in here. The normal values again for a diabetic, the typical way they're diagnosed is fasting blood glucose over 126 milligrams per deciliter on 2 occasions. And if you get 200 at any time, not fasting, but any time, fasting, non-fasting, over 200, you probably have a diabetic. And there are some people that can be picked up by other means and classified as diabetics. But for the purpose, and you'll have to learn those eventually if you treat diabetes or diabetics. But in this course, you don't have to know that. So we're going to leave it at that. That's going to be the end of our case on diabetes.